Hello, good afternoon, everyone. And welcome to today's webinar presentation on the value of certification in infection prevention and control. My name is Tim Cronsberry, and I'm the manager of IPAC support at Public Health Ontario, and I have the pleasure of moderating today's session. I'm sure all of you know that today is the first day of IPAC week. This is a week dedicated to highlighting and celebrating IPAC at the local, national, and international level. It's an opportunity for all of you to help celebrate and promote good IPAC practice in your own organizations. The webinar today kicks the week off, and we'll also be having another webinar on Friday to close out the week, where the topic will be on conducting an IPAC assessment for your organization. So if you haven't seen that registration info for that webinar, have a look at the Public Health Ontario website and look under the events link. Before we begin today's presentation, I'll just mention a few housekeeping items. The chat pod has been disabled to limit any distractions during the presentation, but you can please use the Q&A pod if you have questions during the session. We'll save questions to the end of the presentation, but if you think of a question during the presentation, feel free to add it into the Q&A pod. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca, and we can try and provide some assistance. It's now my pleasure to introduce the speaker for today's presentation, Sandra Callery, and I know many of you will already know Sandra. Sandra is currently the president-elect for the Certification Board of Infection Control and Epidemiology, CBIC, and is presenting the session in this capacity. Sandra has worked in the field of infection prevention and control for many years and held leadership positions at small community hospitals, large academic centers, and long-term care settings. Her current position is Senior Advisor to the Health Protection Department at the Ontario Agency for Health Protection and Promotion, Public Health Ontario. She is an Assistant Clinical Professor at McMaster University's Faculty of Health Sciences and instructor for IPAC courses through Centennial College and Queen's University. She's on the editorial board for the Canadian Journal of Infection Control, and Sandra is a former IPAC Canada president. So with that, Sandra, over to you for the presentation.
Thank you, Tim. Welcome, everyone. And just to repeat a little bit of what Tim said, I'm very happy and proud to be here with all of you during Infection Prevention and Control Week. So welcome to the session. And before we get started, I just want to, my screen is frozen here a little bit, just remind you that this particular slide presentation will be accessible and available at the PHO website. And of course, it's, as mentioned, I'm here on the capacity of the Certification Board for Infection Control. So with that disclosure, no other disclosures for myself or others during this presentation. So we'll go back to the beginning, at least for me, and what certification means for me. And if you've been like me during COVID, I mean, we've been busy enough, but also there's been a lot of time in your own home and finding boxes and bins that haven't been looked at in years. They might be in a closet, in the attic, or in the basement. Well, I had one of those days as well where I decided to do a little sorting, and I came across a thank you card similar to the one that you see before you on the slide. And I forgot, I couldn't even remember what it was for and why I saved it. And then I opened it up, and it actually was a thank you card from the president and CEO of the hospital I was working in at the time that I was certified. I decided on my own that I would take certification in infection prevention and control, wrote the exams, passed, and shared that with my superior, my director, who in turn informed the president and CEO. And I received this lovely handwritten thank you, acknowledging my efforts, also pointing out that they felt that, or he felt that I was actually putting the patient's safety and the quality of the work within the facility first. And he was very impressed and pleased and wanted to acknowledge that. So I saved it because at the time, obviously, it meant a lot to me. And reading it again just reaffirmed for me why I did this in the first place. And you might say, well, why are a lot of us doing it? So we'll get into that in a bit. But first of all, if you're not familiar with the certification board, it's a voluntary board. It's multidisciplinary. And by that, I mean people who work in the field, but come from different disciplines. We come from microbiology, from medicine, from nursing, epidemiology, public health. And we are an independent board. Our primary mission is obviously to find pathways to assess and maintain infection prevention competency. And our vision is really healthcare without infection through verifiable competency. So how can we verify or validate that competency? So the Certification Board for Infection Control is celebrating actually its 40th anniversary this year. It was established by the Association of Professionals for Infection Control and Epidemiology, headquartered in the United States. And it is an affiliate of APIC, but we also have partners. One of those partners is IPAC, the International Federation of Infection Control, and IPAC Canada. The certification board is actually accredited by the National Commission for Certifying Agencies, and it's a member of the Institute for Credentialing Excellence. So I point these things out so that you can see the credibility and the integrity that comes with the certification. So certification by the numbers. Well, currently we're not talking about those who have retired, who are previously certified, but currently we have 8,384, probably 8,400 by the time that this slide has been presented, in infection prevention control. And it's primarily the United States and Canada, but we actually have certificates around the world, so over 40 countries. So it truly is a global or an internationally recognized certification. We also have a new certification that you have seen, maybe if you've been watching or looking closely at our site, an associate IPC, or Associate Infection Prevention and Control certificate. And we have over 271 people with that particular certification, many again in Canada as well. So why certify? Well, if you think about many of our settings that many of us work in, healthcare related settings, long-term care, acute care, accreditation is part of that. And accreditation really helps to ensure that the health and the welfare and the safety of the public is upfront and in place. So this CIC is really just a measure of that competency and mastery of healthcare infection prevention and control. So competency really defines the professional role. So you certify really just it can, first of all, it affirms that certainly if you work hard and put the study and the work into it, you will have an internationally recognized level of knowledge in this field. And I think that's important for a lot of people. It also supports future knowledge and skills. It actually helps you in terms of the reading and the education and the review of publications. It helps you maintain that knowledge and skill. It certainly enhances your professional credibility. And it, from my perspective, and I'm sure from yours, it would provide you a lot of personal satisfaction. Now, every 5 to 7 years, we conduct surveys through the certification board. And those surveys are really to find out how the healthcare facilities are utilizing ICPs, how has that been measured, is there a value, quite frankly, in certification. And we do conduct different types of practice analysis as well to make sure that our exams are reflective of what actually people are working on at the time. So the type of work we do in the field has changed and evolved. So we need to make sure our exams evolve as well. So as I said, every 5 to 7 years, we often do these value of certification surveys. And I participated in the 2019 that you see here published in the American Journal of Infection Control. And this was really a market survey, market research study design. And it's used really to determine the perceived value of certification. We distributed about 35,000 surveys and with a very tight turnaround time of only 12 days, just shy of 2 weeks. And it was actually sent to not only current CICs, people who are certified in infection control, it was also sent to those who have recently retired from the field, and also to people who have not been certified, as well as many of the senior leadership in organizations. So the survey results went out. Our results were approximately a response rate within that 12 days, about 4,400 approximate response. We had about 45% were those who held CIC, about 45% who had not yet had their CIC, about 5.5% that had previously been certified and perhaps had let it lapse or are planning retirement. And then, of course, we had about 4% of the respondents coming from that senior leadership group. We also did a follow-up interviews that were randomly they randomly selected people from those different areas, those certified, those not, and actually carried out telephone interviews for additional feedback and clarity. So with all of that being said, we found that there were some 4 themes or 4 categories within the field that came out or popped out at us. So certification process and standards, professionalism, competency, career growth, patient care, safety, infection prevention control, and then regulatory compliance. So those are the categories that we noticed. Most of the respondents overall, both those who are certified and those who were not, felt very positive about the current standards and the processes and the requirements. They didn't have a problem with the certification process per se. They felt better, although they felt better prepared to carry on the tasks within their organization after being certified. They weren't really sure if it actually led to any monetary compensation. So that was an interesting part to see. They also felt that it overall did improve their infection prevention and control practices and their patient care and safety components. And they felt that it also helped them, certification that is, really helped them with regulatory compliance and really was important for influencing legislation. So those are some of the things that the respondents to the survey told us. Here's a little bit more of what we were able to find out when we did further research. When we looked at those who were certified, and IP in the US is, we call it ICP in Canada, by the way. In the US, they call it infection preventionists. So in the IPs with their certification, they actually found overall higher self-assessed competency. In other words, they felt empowered and they felt more confident in what they were saying and what they were sharing with the staff within their facility. Many of us will be happy to see that salaries with people with CSE was approximately 25% higher than those without their CIC. They scored significantly higher in program performance as well. So when we cross-reference those facilities with those with CIC, in those 5 major infection prevention control program areas, they found higher performance levels than those without a CIC person in the role. And this also included immunization programs and other educational offerings. And now this last one was really looking at the USA jurisdictional scan, but it did show that 77% of potential employers either required the certification or preferred it in all of their job postings. And I think you'll find that in Canada and in Ontario, it is very much the same. So why the CIC? So why this one versus any other certificate, if you will? Well, it does represent a commitment to continual improvement. And by that, I mean, you are recertified every 5 years, which means there's I guess a bit of a stick there in making sure that you always are improving, reading, updating yourself on the infection prevention and control practices and principles. It does foster a recognized professional community that helps to reduce infections in healthcare settings. And I just want to pause here for a minute to recognize it's talking about our professional communities. And this certification is recognized by both IPAC Canada, our Infection Prevention and Control Association here, as well as APIC, headquartered in the US, but also an international organization, professional organization. So through CIC and through those organizations, we actually support and encourage others to become certified. And I think this is really important. It is the only accredited certification in infection prevention and control, which means that the questions are curated, they're carefully researched, they're evidence-based, and they go through quite a rigorous scrutiny in terms of what questions will be asked, how they're phrased. So there's a lot of oversight in the exam itself. So certification, its primary purpose, it's not the same as taking a course or a module and having a certificate of completion. Certification is actually testing you. So it provides a standardized measure of current knowledge required for the person practicing in this field. And it encourages individual growth and study by promoting professionalism. And it formally recognizes professionals in infection prevention and control who fulfill this requirement for certification or recertification. And why is this really important? Well, actually, as I mentioned, we're a multidisciplinary group of people. We come from different professions initially, as I mentioned, microbiology, nursing, epidemiology, medicine. And so the one thing that actually demonstrates our knowledge and understanding of infection prevention control is through the certification process. Now, the only people who can use this designation, of course, are those who have successfully passed the proctored initial exam and then have maintained certification through a recertification process. And we'll talk a little bit more about that. And the CIC credential may be used on your resumes, on your business cards, on your letterheads, and any of your professional communique. But it's important to know that it's not used to promote products or endorsements of products. So what's this certification process all about? Well, we'll start with the exam. So the exam actually recognizes different practice standards for infection control and healthcare epidemiology. So what I mentioned before is that we look at the practices approximately every 4 or 5 years. We have a major review of the practices that go on in our field. And we survey across North America and then internationally as well to see what are the core functions and the roles and responsibilities with infection prevention and control. And then we take that information and weight the exam accordingly to the areas where we spend most of our time and energy. So that's important to know. And it is the only standardized measurement of essential knowledge and skills and abilities expected in this field in professionals, it says here in North America, but now in other countries around the world. So this practice analysis is actually one that I've participated in. For those of you who have been certified, you may also have had people reach out to you to complete a practice analysis. And we do this, and we actually have just recently completed a practice analysis for those of you who work in non-acute care and long-term care settings. And we are just now reviewing all of that analysis, all of that feedback, to see what kinds of practices are required for those types of settings. So we're looking at other congregate settings that are non-acute, and to see whether or not they actually require something a little different than the current certification exam. And this, as I mentioned earlier, the certification CIC through CBIC is actually recognized by both APAC and IPAC Canada as the standard for certification. So how do you apply for the CIC exam? Well, there are eligibility requirements because we want to have certification should come with experience as well. So ensure your eligibility is there. You can look online. You can go to the website listed here on this slide and check for your eligibility, and review that candidate handbook for additional information that you can find as well online. It also gives you hints of how to prepare and study for the exam. The exam costs a bit of money. It's $375 US, the exam and the application fee. So taking that first exam, first of all, it's a proctored exam. In other words, you will be monitored while you carry out the exam. It's an online, computer-based exam. This is how everyone takes the certification for the first time. And there are assessment centers throughout the United States and Canada and other international sites that are accessible for the most part. I will tell you, during COVID, and certainly in some of our remote areas of Canada and the United States, we can coordinate and arrange for a person to be proctored by an individual in certain settings. So if that's the case, if someone is actually in a remote area and it doesn't have access to one of the testing centers, there are contingencies that can be put into place. So it's important to know that when you decide to apply for this, there's a 90-day window from the application approval to the exam completion. So you have that 3 months to submit. Once you've studied and you feel ready, submit, get your date appointed, and then you're good to go. You can see that there's 150 multiple choice questions on the exam, of which 135 are scored. And you might say, well, why did I have to answer those other 15 questions? And the reason there is actually we are constantly trying out and testing new questions. So in that 15, we will be testing out a new question on one of the areas or the domains of infection prevention and control. And we see how well that question, how people respond. Is it too easy? Is it too difficult? Does it need to have more clarity? all of these are questions that these questions, as I said, do not make up your mark at all. They're a way for us to test them out to see if they are ready for prime time, if you will. And as you can imagine, the exam questions are copyrighted on the property of the certification board. So I mentioned eligibility. So who is actually eligible? So successful certification indicates competency of the actual practice in infection prevention and control and healthcare epidemiology. And based on that, it's intended for individuals who are actively accountable for the infection prevention control program within their current position. Now, that doesn't mean that you are have to be the manager before you're certified or the lead for infection prevention control, but it is someone who has accountability for infection prevention and control practices and elements of the program within their position. So this is what we mean. You are to have completed post-secondary education in a healthcare-related field. You can see many examples listed here, but it's not limited to these. So post-secondary can include public, private universities, colleges, and community colleges. And you can imagine as an international certification, it becomes even more challenging for us for knowing all the different nuances in different countries in terms of universities versus colleges versus community colleges. So it's a post-secondary education in a healthcare related field. We want to know that you are directly involved with infection prevention and control activities and the program in your healthcare setting. We look at your work experience and how is it defined. So people often look at their job description. Does it reflect someone working in the Department of Infection Prevention and Control? So it's defined as active engagement in IPAC or infection prevention, and it's determined by your current job description, how you're paid, how you're employed. And this is how we break it down. In terms of the certification, the exam is really set for someone who's been working in the field at least 2 years before, or you can say 1 year full-time or 2 years part-time, or about 3,000 hours. So however you want to divide up that experience. So that's what the exam is set for, that level. So the elements I mentioned, you can see the different components of an infection prevention and control program. So there usually is, we want to see that there's infectious disease processes, surveillance and epi, preventing and controlling the transmission of infectious agents, the environment of care, and by that we mean what is happening around the patient and their immediate environment and at their bedside, or where care is being provided. So it could be in a treatment room as well. Cleaning, disinfection, sterilization, and asepsis. So those are the key elements that we would want to see. And at least 2 of the remaining 3 components that are listed here, the bottom 3 bullets, something around employee and occupational health. Not that you have to manage the program, but how are you interacting or collaborating with employee and occupational health within your organization. Management and communication, and education and research. So 2 of those remaining 3 components should be identified in the role. So before we move from this slide, this is where I get lots of questions. Let's take it, for example, someone who works in public health and they're part of the communicable disease team. And they may say, but I don't head an infection control program. No, but you look at your roles and responsibilities and how does that fit with this particular requirement. So are you identifying infectious diseases? Do you have to know their disease process, the incubation period, how it's transmitted? Do you need to know and understand surveillance and epi? When is something in an outbreak? Are you participating in an outbreak investigations or supporting a long-term care home with an outbreak investigation? And are you providing advice and support and resources around preventing and controlling those transmission of the agents? Are you looking at the cleaning and the disinfection? Are you going through that as part of that role and the environment of care? And of course, there are many times public health inspectors are coming in on site and looking at all of these things. In terms of the last three bullets, you may be involved with communication, speaking and presenting, education. You might be offering educational offerings. You may also be working closely with occupational health and employee health in those settings if there's an outbreak that's involving staff. So just think about all of the work and activity that many people have done over the last 2 years during the pandemic. So once you've received your certification, what happens with recertification? How do I keep this going? Well, individuals who are currently certified are automatically eligible for recertification. So once you've received your certification through that proctored exam, you are automatically eligible to obtain recertification every 5 years. And you can do this in 2 ways, as it says. You can do another exam in case you love exams, or you can do it through continuing education. And we call these infection prevention units, so IPUs. So there's 2 different ways that you can approach this. I just want to pause before we get into recertification about the other certification that's available right now, and that's the Associate in Infection Prevention and Control. And you think, what? Why did they decide to create this? Well, if you've started to think already about what I've just presented around how am I eligible for certification, you can see how you could just be going in just a vicious cycle here. I want to become, and I want to work in this field, but they want me to have certification, but I can't be certified unless I get work experience. So you're in this vicious cycle. So what we decided to do is to create a pathway. And that's what this is. The infection prevention and control exam is really what we think is a perfect stepping stone to prove a candidate's foundational knowledge. So it's core knowledge and recall rather than judgment. But do they know and understand the core knowledge? Do they have an interest and a dedication to the field? And does it give them confidence to start in the field? You may have a general interest, but you do want to at least be able to pursue this. So this is really someone who would like to learn more about IPAC and apply this knowledge to their current role, or see if it can evolve into another role within an IPAC team. So this is intended for individuals who do not meet that CBIC eligibility requirement, as I mentioned, and maybe others who are interested in this field. The second bullet's important. No experience or job-specific requirements are needed to apply for this. This allows a demonstration of your knowledge and understanding of infection prevention and control, and the fundamentals, if you will. Yes, there's an application fee for this, but many people, as you've seen, since it's just been introduced just prior to the pandemic, you can already see that we're probably close to now 300 people from the time these slides were put together who have taken AIPC. And they have found this as an opportunity to work in the field, get into the field, gather that the amount of experience so that they can be successful in the actual certification exam. So it's a proctored exam as well. There's 100 questions. And again, there are 15 questions that are always being tested to see if they're how well they hold up for future exams that are developed. About 120 minutes is given to take the exam, and it's the same content areas as the CIC, but not as requiring as many judgments, and the situations are a little less complex in the questions. So this is the part that you need to know. This AIPC is really as a stepping stone to help someone get into the field and demonstrate they have knowledge, but in preparing them for CIC. So this is not renewable. It's a one-off opportunity, if you will. Once the 3-year period is up, it is expected and hoped that the candidate will be able to continue on to get their certification, their CIC. Now, the other thing is that if you pass this, it doesn't automatically allow you eligibility for CIC. You still must require to be working in the field and have the work experience to go with it. So it's not an automatic. So how am I going to prepare for this exam? Well, you can download the content outline if you go to the Certification Board of Infection Control website, and it will tell you a lot of the content and the areas that you're going to be tested on. It tells you the resources and the material, the journals, the standards that are applied to the exam. So every exam question should be able to be validated from one of the resources that have been are being utilized for the exam writing, for the test writing. Some people form a study group amongst their peers. Some people work more effectively if they're working in a group. Many of our IPAC Canada chapters host study groups, which is a great way of learning and passing the exam, because not only do you have other people such as yourselves writing the exam, but you also are being mentored by someone who has experience and has passed the certification exam. So CBIC has an exam prep resource page for you to take a look at. And there are practice exams found as well. These are usually old archived papers, exam test questions that are made available. And it's not really to, these tests are really to get you comfortable, if you will, with the multiple choice testing method and the timing and the speed at which you need to be able to read and answer questions. It's really getting you comfortable with the format and how it's done, as opposed to being all the answers for the real exam. So here's the content outline. We call these domains. And if you look at them, and you can see how many items, which are really the test questions, how many test questions are given for that topic or domain. So that shouldn't surprise any of you that there's an identification of infectious disease processes, surveillance and epidemiology, and presenting and controlling the transmission of infectious agents as your top 3 areas that are going to be questioned or challenged on the exam. You can see employee occupational health, management and communication, education and research, that environment of care, and cleaning, sterilization, disinfection, asepsis, all coming into play. So you can see how the exam is sort of weighted in all those different domains, and hopefully you can study accordingly. When you look at the AIPC exam, you can see pretty much the same breakdown. Obviously, there are fewer items in this exam, but you can see again, the top 3 are the same as in the CIC exam. Here are some of the exam references that we use, primary references, the APIC text of Infection Control and Epidemiology, the Infection Preventionist Guide to the Lab, the Bible, as we call it, Hayman's Control of Communicable Diseases Manual, and then Ready Reference for Microbes. These are all primary references. In other words, they are our core references. Many of our IPAC chapters have these books or texts on loan. Some of your organizations may find them helpful to buy an online version. Many library services ensure that they have these available if you have access to a library service, and to make these available to you. Now, so writing the exam, now I want to recertify. And I mentioned you've successfully passed the exam, and now you're preparing for the next 5 years when you have to go through the process again. We mentioned that in one way, you can do it through an examination. So this is self-administered. It's no longer proctored. This is where you might have also think of this as an open book test. They are multiple choice. You can do it from any location in your home, and many people have enjoyed this one. People have found this particular self-administered exam quite rewarding, because they've got their books, the resources there, they look at the question that's being asked, they look at the references. Many people have said, you know, I had forgotten, because I'm not working in some aspects or areas, this was a great refresher for me. So some people really enjoy the recertification process in this manner. So the questions are based on the most current civic practice analysis. So it's not stuck in the past. And the purpose of this recertification exam is really to show that you have continued knowledge in this field of infection prevention and control. This is just to remind you of the timeline. So examination is available for purchase the first of the recertifying year. So if you were eligible, if you have to recertify in 2022, the exam would be available to you January 1st, 2022. And you can see that you have right through to the end of the year to submit that exam. So many people, as I said, find this, some people who are procrastinators, of which I am on occasion, may do this in a much more tighter time period, but others may find this really a great way to focus on different areas or different domains each month. Now, recertification by continuing education is very new to the certification board, and many of our certificates have been asking for this. And again, it says domain-specific IPUs. In other words, you can't take all of your units, your infection prevention and control units, in one area because you like microbiology. It can't be all on microbiology. You do have to demonstrate that some of your education and learning is coming from those other areas or those other domains. So this is available now to all candidates who have CIC. So once you're certified, the very next day, you can start to accumulate or acquire these IPUs for yourself. And it can be any time, as it says, during that 5-year recertification period. And you need to gather a total of 40 IPUs. And so you would keep this in your own personal portfolio. And then by the certifying year, you submit it into a database at the certification board. And here are some examples of potential accredited providers. So when we talk about IPAC Canada conference, for example, you can gather a number of IPUs for each day that you attend the conference. You can see it for an awful lot of other professional associations that we have. APIC, of course, SHE out of the usually a US conference, IPAC, as I mentioned before, AMI Canada. All of these would be considered potential accredited providers, providing you with evidence-based knowledge and expertise. So this type of process by IPUs, so January 1st, you can start to put all of that information that you've been gathering, all of those IPUs into the portfolio and recording it all and submitting it it needs to be in a little bit sooner, but it needs to be submitted by October 31st, Halloween. So we do random audits of the portfolios because this is still, IPUs is still a new concept. We've been looking at them quite carefully and getting lots of questions and clarity around what is eligible for an IPU. And if accepted and all of your units are considered appropriate and they have covered at least 6 of the 8 domains that we have mentioned earlier, then you will be eligible for recertification. Here are just some of the resources. This is our executive office for the certification board. And on the right-hand side of the slide is the testing company Prometric that actually sets the exam, reviews the exam, analyzes the exam in terms of what percent, we know for each question, what percentage people get in terms of right answers, wrong answers. Those are all the things that we monitor and measure. I actually just had a call over the weekend with a group looking at the forms review. So we were actually looking at all the test questions that are coming up for the forms for the next exam, and to see are they still valid and accurate. Another group have written the questions. So there's lots of people involved, and one group to keep bias out of the decisions around exams and exam questions or item writing. We make sure that different groups are brought in at different stages of reviewing and editing, if you will, the exam itself. We usually have a few exams in circulation at any one time so that people aren't all getting the same exam at the same time. So I think that covers most of what I wanted to say today. And Tim, I think I'm going to turn it back over to you if we have any questions. I think there's a few in the Q&A box.
Yes, thank you so much for the presentation, Sandra. It was very thorough, and you're right. There are a number of questions in the Q&A pod. I'll try and because some of them are similar, so I'll try and summarize the first one, and that's more around the infection prevention units. So I know that this process of recertifying is relatively new, as you mentioned. But I wonder if you can tell everyone a little bit more detail about those in terms of, you mentioned IPAC Canada conference. What are some of the other activities that can generate these infection prevention units? And also, is there equivalency between different units from other healthcare disciplines, like continuing medical education credits, et cetera?
Excellent questions. Yes, so definitely when I put up the associations on that one slide because it's probably the most common way that people can see themselves getting new educational offerings. But it's not just at a national or international workshop. It can be local conferences and workshops. And I think you need to know as well that if you are a seasoned infection prevention and control professional, and you are putting on a educational offering. So the work that you've put into your slide deck, all the research and editing that you've done, and making sure that everything is fresh and current and speaking and presenting on it, you can get IPUs for doing that. You look at if you're involved with publications, if you have had not a letter to the editor, however, but if you do other publications, then certainly those are IPUs. So for example, if you were an author on a paper that's published in the Canadian Journal of Infection Control, for example, you could get 5 IPUs per publication. I think that we, as I mentioned, speaking at any presenting, if you do a poster presentation, you get 1 IPU per poster presentation. I think that if you're part of another professional designation, we look at, so for example, you might be involved, you might attend a lot of medical conferences. If you're looking at management, communication, education, any of those topics, which are also part of our domain, then you can actually obtain an IPU for those as well. So I would recommend that you take a look on the Certification Board website, where we have actually a PDF table of all sorts of different types of ways you can gather this information, describing how it would be what we're talking about here and the number of IPUs that you can apply to it. So hopefully that will help.
Great, thank you. There's a lot of interest in the Q&A pod, just about more specifics about eligibility to write the CIC exam. So clearly there is a lot of interest in challenging the exam. So some of the questions relate to the type of work that someone is doing in healthcare. So as a PSW, for instance, or as an environmental service manager. Can you talk a little bit about the eligibility requirements for the exam and how they might map to those types of healthcare roles?
Yes, so and that can be a little bit more challenging if you are carrying out, for example, if you do carry out the cleaning, disinfection, and sterilization. I think you have to look at whether or not the CIC is the appropriate certificate if you plan to continue to stay in that one area or that one domain for your work. However, if you're looking for an opportunity to expand or maybe then become part of an IPAC team or depending on the setting, then the AIPC may be the route for you. It would allow you to demonstrate that you have the fundamentals. It would make an employer, a future employer, be confident that they have someone who has some core fundamental understanding and give you an opportunity or a chance. Definitely for CIC certification, you do need that post-secondary education. So take a look at what you have right now, and if you have that post-secondary education, and if you want an opportunity to expand to a full infection prevention control role within an IPAC team, the AIPC might be this first stepping stone for you for that. I will say, and I need to bring this up for everyone because it's early days, so I can't give you a lot of answers, but we are this close to reviewing whether or not we will be creating a long-term care or a non-acute care certification. As I mentioned, some of my Canadian colleagues have completed surveys on tasks and task analysis for those types of settings. And we will be discussing this actually throughout the rest of this year as to whether or not that requires a unique exam. And we certainly aren't at the stage of the eligibility yet for that certification, but it may be a little bit different than the CIC eligibility.
Great, thanks. And it's that's nice to see as well that CBIC is being responsive to the kind of the evolving IPAC needs that I think are becoming much more clear during our collective response to the pandemic. So we still have time for a couple more questions. One specific question asks about IPAC Canada endorsed IPAC courses, but I think there's a couple of other questions in there that are kind of along the same line. So I'm going to ask kind of a two-part. So one of the questions is, how well do the IPAC Canada endorsed IPAC course exam questions, so from Centennial College course, Queen's, UBC, etc., how well do those align with the CIC exam questions? And kind of my own part two of this question is the difference between getting a certificate of completion for one of those courses and the CIC certification, because we hear that a lot as well, that maybe sometimes there's confusion about the two terms.
Yes, Thank you. So definitely certificates of completion or certificates saying successful completion of a course is something completely different than certification, the certification exam. And so those courses that have been described through IPAC Canada, first of all, IPAC Canada actually has an independent group of volunteers who are CIC and work in the field, who take a look at all of the content for all of those courses that are provided. And IPAC Canada will acknowledge or endorse those courses. And when they look at those, they actually, it's that group that take a look at the courses offered and whether or not they feel that they are encompassing all of the core domains or elements that one should see in infection prevention and control. The exam, the certification exam is the certification exam. There might be, when you take tests or quizzes within those courses, they may touch on the domains that should be covered. They may touch on subject matter that might be on an exam, but they aren't the exam itself. And so I think some of the courses, some of the other areas where people have found preparation for the exam has been working in a study group, where a group may purchase an expired or CIC exam to really get the feel for that. But so I think the takeaway here is that the courses that are available are a way for you to gather your knowledge, explore, ask questions. They are, those that are endorsed are meeting all of the domains, or ensuring that all the domains in infection prevention control are being covered, and allow you for questions and application of the material into your setting. They will not be, they may try to imitate the certification exams, but many of them now actually have more quizzes and feedback and exercises that you need to complete. So they're preparing you in a more fulsome way, which is a little different than the certification exam on knowledge and practice.
Right. Okay. Thank you. Thank you for that. Again, lots of questions that are similar and talking about various experiences and qualifications to write the exam. And just to reiterate one of the points that you made near the end about the associate, the CIC.
Yeah.
So I think you mentioned on your slide that if someone is successful in the ACIC, that doesn't automatically qualify them to challenge the CIC exam. They still need to go through the other process, correct?
Correct. It doesn't make you automatically eligible for CIC. You still have to have the hours of experience in the field for CIC. The certification is really saying that what it's telling, if I were hiring someone and they come in with a CIC, I will know two things automatically. They understand, they have the core elements and fundamental knowledge around key components or key domains of infection prevention and control. And they have had some experience in working in the field. So it's that combination that CIC is providing, not only yourself and recognizing those who have worked in the field, but also what it tells for the employer and for others who are working with you. So it's experience as well as passing the exam. And again, one of the things I think that also you may have been hearing in the background is that there's here in Canada as well as in the United States, I mentioned earlier how we all come from different professional groups and different backgrounds. And so they're looking at whether or not there can be a degree in infection prevention control. Is there an actual master's in infection prevention control or a bachelor's of infection prevention and control? So where all of that is brought forward. Those are being explored as we speak.
Well, certainly lots of opportunity and lots of interest in this. So Sandra, thanks again for the presentation. As we wrap up today's webinar, I'd like to thank you, Sandra, for presenting. I also really want to thank everyone who joined us for the webinar and all the questions. I know we couldn't get to all the questions in the Q&A pod, but it's great to see such strong virtual participation during such a challenging time. And everyone participating today is demonstrating your commitment to IPAC by learning more about certification. So it's great to see. All participants can expect to receive a brief and anonymous survey for today's session. So please try and complete this to help us improve our programming. And lastly, to access past presentations and view confirmed upcoming sessions, please visit the Public Health Ontario website, head to Education and Events. It's a link on the left-hand side of the screen, and click on Presentations. So with that, thank you very much. Have a wonderful day and a fantastic IPAC week.